Now starting. All attendees are in listen-only mode.
Hi, good afternoon. Today is September 18th, and I'm Donna Will, Professional Development Coordinator for the Developmental Disabilities Administration. We welcome you to the Friday series of DDA updates. Our presenters for today include Bernie Simons, the Deputy Secretary for DDA, Patricia Sastoki, Director of Programs, Valerie Roddy, Director of Fiscal and Operations, Stacy Jones, Statewide Employment Services Coordinator, Rhonda Workman, Director of Federal Programs, and Chioma Ani, LTSS Program Manager. Before we begin, I'd like to go over a few things about the webinar. All participants are in listen-only mode. There's one option for listening, and that's by computer. We have a handout, and you can find that in the handout section in the panel to your right. They can also be emailed on request. We are recording the webinar and posting it on the DDA website. Questions can be typed in the question or chat box in the webinar panel, and we will answer those towards the end of the presentation. So now I'd like to introduce Deputy Secretary Simons. Good afternoon.
Good afternoon, and good afternoon to everybody who is participating on this webcast. I want to thank you for your support in the number of weeks we've been going through this since the pandemic started with COVID, and hopefully that these webcasts have been informative and resourceful. So today we're going to share some updates around employment data initiatives and the DDA's implementation of the electronic visit and verification information. We have had two conversations with the East region and with the West region, the providers, and did training earlier on this week. So I want to thank everybody who participated in that. And so as we know, in looking at our opening remarks, as we do, the health and safety and well-being of everybody and their families and our staff and all of our providers are a top priority for us. And I want to thank everybody again for their continued support with being on these webcasts, and DDA will continue to do these and engage in any topics of interest that you would have. You feel free to basically email us and say, this is something that we might be interested in. We have had that in the past where we've had a couple of providers in a couple of different weeks present about what their thoughts were about going through COVID and what they had to go through with people who were isolated or quarantined and their thoughts about reopening. So in one of our last webcasts, there were questions that were submitted, and Dr. Fetter was going to answer those, etc. He's been out on leave, and he is just returning this week. So once we have his responses, we will be posting them on the DDA website, and we'll email them to all the attendants of the webcast. And again, I apologize and I'm sorry for the delay, but he obviously was out on leave. We also received this last week our 5th round of PPE. So please continue to engage with the regional office and get your request in so that you can get PPE. And so now this week, it's real important for everybody. We have the Direct Support Professional Recognition Week. And I just want to take the opportunity to thank all of our DSPs that support people with developmental disabilities, whether that be in day services or in residential services or in personal supports. Everything that you do is just outstanding. And I will say that that's how I started in this field as a direct support professional a long time ago. And so near and dear to my heart, all of the hard work that you do and all of the implementation that you do and the friendships that you build with people that you support. And so I just want to go over what the governor did in the proclamation, because it's a little small on the screen, and it says, whereas direct support professionals are vital to the life experience of many people with disabilities in Maryland. From employment support to community living assistance, DSPs are often the difference between community participation and isolation. Whereas DSPs have been on the front line of the 2020 coronavirus pandemic as they continue to arrive to work every day, ready to do everything they can do to ensure the health and safety of the people with disabilities. And whereas we believe in Maryland, which recognizes the unlimited potential for all of our citizens, including those with disabilities, to live, to work, and thrive in our communities. And whereas the Direct Support Professional Week is an opportunity to recognize the important work of those who ensure inclusive environments with equal access to all that contributes to the community life for those with disabilities. And whereas we are changing Maryland for the better by promoting equality of opportunity, access, and choice for Marylanders with disabilities, we are committed to the promise of knowledge and influence to make a difference in everybody's life. Now, therefore, I, Lawrence J. Hogan Jr., Governor of the State of Maryland, do hereby proclaim September 12th through the 19th, 2020, as Direct Support Professional Week in Maryland, to promote events throughout the year, which will celebrate the abilities for all of those with disabilities. Thank you, DSPs, for all your work we've done. I think that was a great proclamation that we received from the governor, and we thank the governor for that. And so we'll move on now to our updates that we do with the southern region and with the east, and let's start with south. So as of the 17th, yesterday, the South region had 263 participants in our services confirmed positive. 7 tests were negative. 7 are pending results, and we have had 17 people pass away. In the East region, we've had 39 confirmed positive, 142 negative, 3 pending, and no deaths. In the Central region, we have had 255 positive, 581 negative, 16 pending results, and 18 people who have passed away. And in the West region, we have had 43 positive, 212 tests were negative, 1 pending, and 3 people have passed away. For our DSPs, and again, this is up to date, we have had in the South region 190 staff that test positive, and 4 people have passed away. In the West region, we have had 46 positive and 1 person passed away. In the East region, we have had 79 people test positive and 0 deaths. And in the Central region, we've had 271 staff test positive, and we have had 2 deaths. You'll see on the next slide where we are with our information that, again, ended yesterday on 9/17, with the pie chart on the left, maintaining a consistency of about 97% of the people who are in services with 3%, who have been okay, and about 3% or 638 people who have tested positive. The chart on the right obviously is a breakout by the regional office that's color-coded, and you can see actually the numbers below that in like a little chart. And so for our tracking, we basically have started to look at where we are. You can see that from August 20th to yesterday, we had no increase in participants who passed away. And so that whole total is 638, 38 people who have passed away, and deaths and 600 people who have tested positive. And so, and again, the pie chart on the right is just a breakout rather than just a line graph, so you can see what that looks like with the 6% of the people who have passed away, of the 638 who have tested positive of the total. So with that, that's our report. That's our updates. Again, saddened every time we have to talk about the number of people who have passed away, either who are in our supports or our direct support professionals, or even family members of everybody within the DDA family. So I mean, this is a tough time for everybody to go through. And again, be safe and wash your hands, keep your social distance, and all of the things, wear your mask, and all the things that we've been talking about. I want to now turn this over to Stacey Jones, who's going to talk about the employment initiatives.
Hi, everybody. So I'm going to provide a brief update related to DDA's Employment Data Initiative. And before I get into the actual data, I'm just going to remind you, for people that may not be aware, DDA's been tracking individual level employment data outcomes for people that are in our Meaningful Day services since 2014. And we do that in partnership with the State Employment Leadership Network, or the SELN. And they house all of our data on a public website. And for those of you that haven't taken a look, I included the hyperlink right there, or the URL, so you can check it out. Our typical data collection cycles usually happen in May and October each year. So that means that our last data collection was actually due to occur this past May, but due to COVID and the fact that both providers and DDA were responding to that situation, we did not do our typical data collection cycle. Instead, we worked with our subject matter experts at SELN to create a very, very modified survey that was just used to gather some aggregate data, really to provide a snapshot in time. So that survey was sent out in June. We gave providers until the end of July to submit their data. It went out to 114 providers, and out of that number, 72 providers responded. Next slide, please. And I want to share some of the major data points that we were able to capture from that survey. Really, what we wanted to know is what was the real impact, a real-time impact on people's employment status due to COVID. So for the purposes of this data, we really considered March 1st as a point in time that we considered to be pre-COVID. So we asked, out of people that had been employed pre-COVID, in June or July of this year, when this survey was sent out, what was the work status of those people? And that's what we're able to see on this chart, and I'll walk you through it. So starting on the left-hand side, what we saw was that 48% of people that had been competitively employed pre-COVID were still working their typical hours in June and July of this year. At the same time, 44% of people that work in individual contracted jobs were working their typical hours, and 59% of people that were working in group supported jobs were still working their typical hours. So a fair amount of people were continuing to work during COVID, during the period of June and July. And then you see the next data point, number of people who were working a reduced hours from their typical schedule pre-COVID. 5% of people that were competitively employed, 8% of people in individual contracted jobs, and 3% of people in group supported jobs were working reduced hours. Then we moved over to furlough. So again, people that were working pre-COVID, 27% of people in CIE were working or were furloughed, 30% of individual contracted jobs, and 20% of group supported jobs. And then I want to go over to the right-hand side where it talks about voluntarily not working. So this would be the category of people that possibly are still employed or were still employed, but had chosen not to be working at that during June and July for whatever reason. And we didn't ask any more specific information on that. Next slide, please. Next slide. Okay. Oh, thank you. So this slide shows how percentages in each of those work statuses compare with other SELN states that measured similar data. So along with Maryland, there were 7 other SELN states in the United States that decided to gather very similar data to ours in the same time period, so around June and July. And you can see that Maryland did slightly better in most of these data points. So for instance, 53% of people that had been working pre-COVID continued to work at this time as compared to those national SELN numbers at 46% in the other SELN states. So that's positive. Next slide. So again, it's important to note that this was a moment in time. We didn't ask a lot of additional questions because we really just wanted to get a snapshot, and we didn't want the data collection to be overly, we didn't want it to be additional work for providers that were dealing with other things at that time. It doesn't give us the full picture necessarily. So we're continuing to explore with the SELN some various themes that kind of emerged at looking at the data. For example, things like individual choice and dignity of risk. We don't really know if all people that were employed were informed and supported to explore any or all options related to employment. We don't know about people's access to technology, and perhaps for the people that did continue to work, how many people were able to do so because they were receiving supports remotely or via the use of some sort of technology. We're very interested in getting that kind of data. Next slide. So DDA's next employment data tracking begins in October. Just waiting for the slide to move ahead. So that happens in just a few weeks. We'll be back to our typical individual level data tracking. We're working with SELN to add just a few additional data points that do relate to COVID or COVID supports to assist in tracking that impact both now and over some period of time. So we're looking at being able to track how much of the supports that people are receiving that support any of the outcomes that we measure were done via remote support, because we just don't have that level of information. And also being able to assess whether people do have the necessary access to technology so that if they do need remote supports, that they're able to access them. And things like, did a person lose their employment in that period of time? And if so, was it directly related to COVID? Because we know, certainly throughout the year, it's common that a person would leave a job or lose a job, but this time around, we want to be able to gauge, is some of that job loss or a large percentage of it directly related to COVID? So our October data submission is due by the end of November. And as always, we will share the data collection on our public site when it's ready. So if people have questions or want to find out more about this, please feel free to send me an email, stacy.jones@maryland.gov. Thank you very much.
So Chioma, you're up.
Can you all hear me?
Yes.
Okay, great. Good afternoon, everyone. Sorry for the technical difficulties. So we'll spend some time just giving some brief updates about electronic visit verification. Again, as most of you are aware, the DDA is implementing electronic visit verification for personal supports in order to meet the requirements of the Federal 21st Century Cures Act by January 1st of 2021. Next slide, please. So the implementation, as has been previously shared, will be by region, starting with the Eastern and Western regions on October 1st. Providers who support people in personal support services that function in multiple regions will be transitioning to EVV at the latest dates for the region in which they operate. So for example, a provider who serves people in the Eastern and the Southern region will be transitioning to personal supports on November 1st. You can see the implementation dates that are listed here with the identified regions and the expected date on the right. And DDA does plan to achieve full compliance by the CARES Act deadline by January 1st of 2021. The link that is provided here will allow you all as provider agencies to see your agency name and date listed, and that is on the website. Next slide, please. So we are currently in the process of training provider staff for being able to function billing in LTSS. In addition to the trainings that are happening in live sessions, here are links to LTSS Maryland training videos that are pre-recorded short webinars. The webinars walk through various parts of the system, how to enter EVV services, how to search and view EVV services in provider portal, how to modify them, how to review them, and then additional reports around that process. So the information in these webinars is reviewed in detail in the training sessions, and the training sessions will provide you an opportunity to practice with the trainers. The training sessions, again, focus on billing staff's responsibilities and is not for program directors or staff who will not be carrying out billing functions for their agency. All the information in these billing webinars are available to provide additional guidance around billing. For any general information around LTSS Maryland navigation for provider users or on how to manage your staff in the system, please see the other videos on the website as well. Next slide. So here is a copy or a screenshot of the training calendar. We just want to use this opportunity to emphasize how critical it is to have the appropriate people attend the trainings. If your provider agency staff are not able to attend training that you registered for, please do not give your training link to another coworker. It is also critical that people who register for the trainings attend the appropriate session that they registered for. For the first 3 training sessions thus far, we have had a no-show rate of approximately 30%, and those are spots that other providers could have used. So we just want to make sure that if you're registering for a session, that you do attend the appropriate session that you registered for. If something comes up and you are unable to attend, please inform the professional development coordinator for your respective region. Next slide, please.
Hi, this is Rhonda Workman. Happy Friday, and looking forward to sharing some information about our EVV dedicated webpage and some of the resources. So we want to make sure that our stakeholders have the information and tools available to provide guidance and resources as we move forward with implementation of EVV. And so we've created and shared a number of resources, such as a dedicated DDA EVV webpage. We've recently shared information about EVV stakeholder toolkits that we'll talk about today, that includes a participant handout, tips for our direct support professionals, charts related to the implementation timelines, and also information related to specific provider go live dates, in addition to EVV related webinars. Next slide, please. What you're going to find on the dedicated DDA EVV webpage is the following structure. We're going to include memos and correspondence under this category. We have created and will expand on at-a-glance documents. These are our easy to read 1 to 2 pagers that provides information that is consumer friendly. We are gathering questions from our webinars, our calls with our regional office providers, and we will be establishing a frequently asked questions document. And then we have toolkits that we have classified for participants and families, coordinators of community services, direct support professionals, and provider leadership. And you'll see some of the information as we go through the next slides that we have already created and new ones that we are interested in hearing from you about. In addition, we have some of the webinars that we recently committed. On this slide is a demonstration, a picture of the actual DDA homepage. When you go to the DDA website, you will see up at the top banner, we have created a direct link to the electronic visit verification, our EVV page, as noted with the yellow arrow. Next slide, please. When you click on that arrow, or when you click on that link, it'll take you to the dedicated EVV page, which shown here will have an initial paragraph introduction about EVV. Next slide, please. And under that initial paragraph, you're going to see the structure that we just talked about, including the memos, the at-a-glance documents, the frequently asked questions, which will be populated once we collect them, the toolkits that we talked about, in addition to the webinars. Next slide, please. Some examples of what you're going to see that's on our website, and we've included links in the slides so that you can easily access them. First is our at-a-glance document related to EVV. You're going to see that it provides a description about what EVV verification is related to. It'll talk about the in-home support assurance system, which is what the Maryland Department of Health is using, and also some benefits. On the second page of it, it talks about the distribution of one-time devices, what we refer to as OTPs. Next slide, please. Under our toolkit for our participants and families, we've added some resources to support also. For instance, we have created a DDA ISS participant handout. It's a 2-page handout that provides some information about what the in-home support assurance system is, what does it mean for people receiving services, and what is a one-time passcode device. You'll see here on the screen that we also included a visual of the OTP to help familiarize people with it. Next slide, please. For our families, our Director of Family Supports, Marianne King-Bresci, will be facilitating a conversation about how EVV works at home and in the community. She's gathered a panel together to include a Maryland family, DDA provider, and also Medicaid staff so that you can hear about their experiences and have a live questions and answer session. The date of these webinars are posted here. It includes September 30th and October 28th at noon. There's a link that you can easily register or also go onto the DDA training page. Next slide, please. For our coordinators of community services, our CCS agencies, we've recently had a call with their leadership where we've shared information and a presentation related to guidance and assigning of OTPs. In addition, working with our partners from Medicaid Provider Services, a CCS guide in terms of ISIS implementation and assigning and managing OTPs has been distributed. It is also listed on the web page so that you can access and view. Next slide, please. For our direct support professionals, under their toolkit, you're going to see that we have created tips for DSPs, an EVV wallet card that can be used by providers and staff, in addition to information about a new DSP ISS practice phone line. Information has been created with input and advice from our current pilot providers as they have been using the EVV system under the pilot. Next slide, please. In terms of that practice line, to share some additional information, the DDA and Medicaid have established an ISIS practice phone line. This means that the direct support professional staff can go in and practice on a line without actually entering or implementing with billing. DSPs can call in and practice calling in, clocking in, and clocking out of their shifts. They can do this using the participant's phone line or by using an OTP device. The practice line is live now and available through January 15th. The reference here in terms of the practice memo, in addition to guidance, is available now on our website to support your staff in practicing with the EVV system. Next slide, please. For providers or provider leadership in general, our pilot providers have shared a number of tips that we put together in an at-a-glance document. It is seen here on this slide. It includes the importance and recommendations about training and training staff, using text lines in the event that is needed. Also what to do related to challenges with landlines or no cell services. So this information is available on the website, in addition to a listing of all the providers and when their targeted go live date is, and also the implementation timeline by our regions. Next slide, please. So the DDA will continue to build out these toolkits that we've just mentioned, and we're going to continue to host regular presentations and open mic question and answer sessions on EVV for all stakeholders. You heard the Deputy Secretary mention today that this week we had a call with our Eastern Shore Regional Office and our Western Maryland Regional Office providers of personal supports. And it also included the coordinators of community services so that we can have a dialogue and support with additional information and address questions. Please attend and share examples of what's working and what is not working. We want to be able to support all stakeholders as we transition to the EVV system to meet the requirements of the Federal 21st Century Act. Together, we know we can achieve it as we work together as a team. Next slide, please. And then finally, just a reminder that Amendment number 3, 2020, is available for public comment now. We have shared webinar specifically to Amendment number 3 and mentioned this in previous Deputy Secretaries' webinars. These are the links to the actual dedicated pages for each of the waiver programs. And also we've included the email address or option to mail in your comments. Just a reminder, you can submit one letter or notice related to your comments, and we will apply them to all 3 waiver programs. That way you don't have to submit 3 separate documents, because we will consider all comments for all 3 waivers. Next slide, please. So now we're going to go to our questions and answer session. I'm going to help to facilitate some of the questions and be working with Chioma, Valerie, Roddy, and Stacy to address some of those. The first question is, can a deaf staff person utilize a relay service to call in for EVV? Chioma, can you help us with this question?
Sure. So a deaf staff person who works as a DSP for a provider agency will be able to utilize the EVV system. Currently, there is no TTY version for the clock in, clock out, but there has been provisions made for the provider billing or admin person to be able to manually enter the clock in and clock out for those individuals who are deaf or hard of hearing. The specific guidance around that is included in the service modification guide that is referenced in the training and will be posted shortly as it is being updated by our Medicaid partners.
Thank you, Chioma. Valerie, we have another question that says, does DDA want providers to bill the extra C days, meaning retainer payment days, up to 30 days, going forward, starting with the September billing, or can we go back before September if a client depleted their 18 days?
So I think the one thing that is important to remember that retainer days, we are limited to 1 incident, which means that the retainer days have to be together. They cannot be separated. It's one instance, so it's a straight 30 days consistently, consecutively. And I think that's important to note. So at this point, if an individual has used COVID days in May, for instance, they cannot use retainer days in September. So it does have to be consecutive.
Thank you, Valerie. Stacy, there's a question here. When will the employment data information go out to providers?
Okay, well, the information was sent to executive directors, I want to say last week or the week before. So if there's a particular staff at a provider agency that needs access to the actual site, I would say ask your executive director, and if they still need help, I would suggest you email me directly, and I'll make sure that you get connected to our technicians at ICI, and they're the ones that actually house the data.
Thank you. Valerie, there's a question. Who do we contact to be on the provider list for EVV?
So if a provider is not currently licensed or approved to provide personal support services, then it is important for that provider to go through the ePrep process to add that service to, so that they can bill for that service. If a provider has not already designated itself as a personal support provider, then you will not be able to bill for those services if you are providing them to an individual.
Thank you, Valerie. Chioma, the next question is, as a provider, we have not been trained yet. Who do we contact regarding this?
Sure. So the training calendar for DDA is on the website. The link is also included in this presentation. If you navigate to the website and click on training, you would be able to access the calendar to register for a session. For providers who are going live on 10/1, it's recommended that you attend a session next week or as soon as possible for billing functionality, so that your billing staff can get adjusted to the processes that are required.
Thank you, Chioma. There's additional question related training. It says, will there be additional LTSS training for providers because providers couldn't attend last January or had staff turnovers?
Sure, so that's a good question. Some of the materials, or I should say actually all of the materials that were covered in those sessions are currently posted on the DDA website. If you navigate to the LTSS page, under LTSS Maryland training videos, you will see the webinars that walk through how to administrator staff provider, how to walk through the service referral request process, and how to complete client searches. So those are the materials that were covered earlier this year. They are recorded and posted on the website.
Thank you, Chioma. The next question is also for you. It says, how do staff who need to enter the provider and participant's Medicaid number typically remember or have these on hand as they call in?
For the provider MA number, the toolkit that Rhonda, you mentioned earlier, includes a wallet card for DSPs to be able to write that information down to enter into the system. It is rare that you would need the person's MA number in order to clock in or clock out. If that person has an OTP device, you would be using that instead.
Thank you. Valerie, the next question is, when will we know more about EVV for self-directed participants?
DDA, that is a good question, and DDA is working on that currently. We have a new FMS vendor selected, and we will be taking a contract to the Board of Public Works at the end of October. That vendor will be responsible for standing up an EVV solution for people in self-direction. So we should have information coming out probably probably around November, if not sooner.
Thank you. The next question, Chioma, if you want to address, and I could add to it, but it says, are families who are providing personal supports under Appendix K expected to register for EVV?
For individuals who are receiving services under a provider, services are being provided by a DDA approved provider, the provider must use the clock in, clock out process to move forward. If you are referring to individuals who are under self-direction, who may have family members assisting with service provision, then that would fall under the bucket that Valerie just mentioned. Lana, did you have anything else to add?
No, I think that's absolutely accurate. So if our family members are providing the service on behalf of a provider because of the remote supports or the current COVID situation, that it would be under the provider's guidance and billing instruction. If it's self-direction, then it would be based on what Valerie had shared. Chioma, the next question is, how will providers be able to bill for 2-to-1 staff ratios for personal supports?
So again, personal supports, according to the definition for the service, is a 1-to-1 service. You will not be able to provide personal supports as a 2-to-1 service and accurately bill in LTSS. If that person does require 2-to-1 services, then it's likely that they align with a different service model or a different service overall.
We had another comment that someone tried our family supports link for resources and it was not working, so we'll look into that. Thank you for sharing. We did test them and they were working, but we'll circle back on that to make sure that there hasn't been something happen there. Next question is, who can a provider contact if they have issues or problems with the practice phone? Do we reach out to the regional office or LTSS? Chioma, can you help us with that one?
Sure. Any questions or issues with the practice line should be directed to the ISAS team. I believe the contact information is listed in the guidance that was provided around the ISAS practice line. So there's the memo that includes that information.
Yes, thank you, Chioma. So just for our audience members, there's a memo related to the practice line, and then there's a one-pager tool that can be used to practice onto. The next question, Chioma, can you help us with, says, when will CCS have the OTP devices and distribute to participants?
Sure. So CCS agencies all currently have the OTP devices. They were distributed a couple weeks ago in bulk to each CCS agency. As we understand, CCS agencies are coordinating with the region and with some providers to plan distribution as close as possible to the go-live date for each person based on their provider. And the reason for that being that the device does not get lost or lay around the house and not be found when it comes time to start using it. So the tokens are in the possession of CCS agencies and they have begun implementing distribution plans.
Thank you, Chioma. The next question is, for EVV, how are participants supposed to receive personal supports over 82 hours per week? Does the system have any limits in terms of the hours the person could receive?
The system does have some limits to the number of hours that a person can receive based on the day. For those who are receiving a certain number of hours or an enhanced number of hours, the only advice there would be to ensure that they are receiving the appropriate service, whether that is personal supports or personal supports enhanced.
Thank you. The next question, Chioma, maybe you can help us with. It says, looking at EVV from the viewpoint of families and participants, briefly summarize what is EVV? How will it benefit us? How are we involved in the process? What should we expect to see from the providers regarding this? How does EVV impact self-directed services?
Sure. So there are a number of questions, Rhonda, and that wrapped into one. I think that the family webinars that were mentioned that are upcoming at the end of this month and in the month of October will be a great forum to talk through some of those and get a deeper understanding for individuals and families. Now, what I will mention more generally is that the EVV process overall allows DDA to be able to review service activities and entries for providers and encourages providers to complete billing and entry of services and tracking of service delivery more acutely or as quickly as possible.
Thank you, Chioma.
So Rhonda, this is Fowler. I'd just like to add to that. So I think what's important to keep in mind is that the EVV system is really designed to be a fiscal accountability mechanism. It is something that is required by the federal government, and so that is why it exists. It should not, in terms of the services that an individual receives, those should remain unchanged and should be totally unaffected by the use of an EVV system. So I want to make sure folks are clear about that it really is an administrative function and should not interfere with the provision of services in any way.
Thank you, Valerie. We had another comment that says, please consider placing a user-friendly acronym glossary on the DDA website. Since as DDA increases their toolkit volume, so does the amount of acronyms increase. As a parent, it is becoming increasingly difficult to retain the definition of all the acronyms. I think that's a great suggestion. We appreciate that, and we will work on that. Valerie, another question related to retainer and COVID days. The question is, what is retainer and COVID days?
So fortunately, last spring, the state was able to submit an amendment to our waivers under a certain appendix. You know, the waivers have different sections. And in this case, we were able to add some flexibility to how services are provided during this public health emergency. That section is referred to as Appendix K. So through Appendix K, we were able to request and the Centers for Medicare and Medicaid Services approved our request to allow retainer days for services that previously did not have retainer days. And these are days in which services are unable to be provided. Maybe the participant, unfortunately, may be sick and may not be able to participate, or the provider may not be able to provide the services at this point in a remote fashion. So the retainer days allow us to pay the providers some money for that day, because the providers still have to maintain their staff, even though services may not be provided on that particular day, or could be days. So it is a way to ensure that providers have the necessary staffing resources to continue services once they can be provided. So we have retainer days. Now, in residential services, we've had retainer days, but they're usually referred to as maybe bed hold days. And so that has been in practice and has been improved for many years. And so DDA had that in our waivers. But the retainer days are new to services such as day habilitation. They were not allowed previously, but they are allowed under this public health emergency.
Thank you, Valerie. We also are getting some questions about, since CMS has approved us going up to 30 retainer days, providers are asking about whether DDA is prepared and they're able to start submitting error and update reports for the additional 12 days.
So again, as I mentioned earlier, when the question was asked previously, that retainer days do need to be consecutive. So if an individual, for example, was not able to receive services and the provider wanted to use a retainer day to cover that, and that was in May, and they used up to their 18. But in reality, the individual was not able to be supported on additional days, like let's say an additional 5. Then providers can submit an error update to correct that in May. You can't, however, if there were 18 days used in May, you cannot use an additional 12 in September because, again, the days need to be consecutive. What I would say is that the providers can submit these. I may have mentioned this before, but during our year-end closing, we received over 2,500 error updates to be processed. And that volume is almost, not quite, but almost double what we normally receive. So we do know that a number of them related to some corrections that needed to be made. So what I would say is, by all means, submit them, and we will process them as quickly as we possibly can.
Thank you. We appreciate that. Chioma, here's a question you could help us with. How does EVV work when providing personal supports in the community and not in the person's home? Let's assume the person is not able to reliably keep an OTP on them.
The expectation for individuals would be that there is an OTP code assigned if that person typically or usually receives services in the community and does not have a reliable phone that is available to use with the ISAS system, a cell phone, for example, that they carry around with them. If in the instance that an OTP is assigned for the individual, and through the course of service provision over a couple of weeks or over the next few months, the OTP is repeatedly lost or broken or damaged, please reach out to the ISAS team so that a process can be followed to see if there is an alternative way for setting up that person. But at this time, the expectation is that the individual will have an OTP token if there is no reliable phone, and that will be used whether services are provided in the home or in the community.
Great, thank you. There's a question asking us if we can give details about the September 30th training. And so in the PowerPoint presentation in the handout section, you should be able to download it. There is a link on that slide that you can click to register. In addition, information will be posted on the DDA webpage in terms of our training calendar that you can click on and register. And also DDA will send out a notice through our constant contact. So an email blast will go out encouraging people to register for the webinar. Again, it will be facilitated by our Director of Family Services, Marianne King-Bresci, and I'll have a panel to include a family, a provider, and also Medicaid, so that we can have question and answer, open mic type of opportunities there too. Okay, just going down to some additional ones. Some questions about CCSs and knowledge and information about EVV and the process for distribution and registration. And so recommendations for us to continue to work with the management to make sure information and policies are clearly conveyed to them and their staff to get adequate training. Thank you for that comment. As we shared, and we will continue to provide information, guidance to our coordinators of community services. We do have on our website that guidance related to the CCS in terms of distribution and management of the OTPs, and a PowerPoint. And just another comment related to DDA's trainings. We also post information on our Facebook page, so we encourage you to join us on Facebook as we also share information through Facebook. There's questions related to retainer payments. One is retainer days for personal supports. What happens if the person is not using their hours each month? Just a reminder that personal supports for the person, you coordinate with them in terms of the services that they need. If they're not using them, then as per the Appendix K guidance that we have on our website, a provider could submit retainer payments for personal support hours. And just going through to see if we have some new ones. Had a question about processing self-directed person-centered plans at the regional office. We are processing them and reviewing them. If you are experiencing a challenge related to that, we encourage you to reach out to our regional office directors who can help facilitate that. So feel free to contact our directors and we can help facilitate your questions and your needs. The next question is, we are currently offering remote services under waiver 1135K, but are not an approved person-centered plan agency. Can we continue to provide remote services? If so, should we send staff for EVV training? So I'm going to comment a little bit and then Chioma, I'm going to kick it to you. If you are an approved DDA personal supports provider agency and are authorized to provide services for one of our participants as outlined in their person-centered plan, then you should pursue training for your staff. If you're not an approved person-centered or not an approved personal supports provider agency, then you should not be sending staff to our training because you're not in our system and would not be billing. Chioma, do you have anything you want to add to that?
No, I believe that covers it.
Okay. The next question is, how do we let CCS workers know we need to use those devices for certain individuals? I would suggest that if you're a provider agency and you have concerns about the use of their phone, that you communicate and coordinate, partner with the CCS agency related to those needs, and the CCS agency, the CCS can assign the OTP for the participant. Chioma, anything you want to add to that?
Yeah, it's important to coordinate, I think, as you've mentioned, Rhonda, to make sure that everything is done to the best needs of the participant. If providers, you are aware that there's a need that maybe the CCS agency is not aware of, or they haven't gotten to that yet, please communicate to the CCS agencies so that they can plan accordingly.
Okay. There's a question about what is the exact hour limit that EVV allows for per day or per week. From my perspective, EVV and the billing is based on the authorized person-centered plan. This is why we are working to review all person-centered plans for people with personal supports to ensure that they accurately reflect the services being provided, and that will also support the provider in the billing. So the limit would be based on the service authorization within the system. Chioma, do you want to add anything to that?
No, that is correct. The authorized PCP determines the limit.
There's a question about if a person's receiving new services, such as personal supports, how long does it take for EVV to be set up in LTSS, receive the device, and will services start on their start date given?
That's a good question. If someone is coming in new to personal supports for a provider, what the process is that a PCP needs to be updated to include those services. In the coordination effort around the PCP and getting that updated, then the CCS would be aware and tokens can be distributed if needed. There is no additional setup of EVV per se in the authorization of the PCP. DSP staff for the provider agency can clock in and clock out and be able to get billed appropriately.
Thank you. And this will be the last question. I know that there seems to be similar retainer day questions. We'll share those with Valerie, and you know, we could look at some additional information related to the retainer payments and the error reports. But the last question, Chioma, is can we guarantee the staff Social Security number is secure when having to frequently enter the full number into someone else's phone?
Sure. So the phone operation is secure. ISAS system has been in use by the state of Maryland since 2013. There are over 12,000 people in other Medicaid services that are currently using the ISAS system, which does require the DSP staff to enter their Social Security numbers. There has not been, since that system has been in use, any reported breaches with DSP Social Security numbers. So we believe that the system is safe and secure for entering of private information.
Thank you, Chioma. So we appreciate your time and your questions. We will be sharing the questions with our teams and following up. Bernie, I didn't know if you wanted to close out with any additional information.
No, I just want to thank everybody for, again, attending these webinars. We've got a pretty good attendance today, over 400 and some odd folks here. And again, I want to congratulate all the DSPs, you know, the governor's proclamation and all of the hard work that everybody does. And please stay safe and have a great weekend.